Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Ronald Zent. He's a family physician. His Kevin MD article is titled, How We Were Duped and What We Can Do About the Opioid Overdose Crisis. Ronald, welcome to the show.
Thank you so much, Kevin, for having me. And thank you for all that you do and with your platform and allowing, voices to be heard, from other healthcare professionals, nurses, doctors, everyone that, is in the healthcare arena. So yes, my background is I had a circuitous route to be a physician. I was going to be a minister at one time, and then I changed and ended up going to Mexico for medical school for a couple of years in Guadalajara, transferred to University of Oklahoma in Tulsa, and then came out to California in like 1980 and 81 and finished up at Loma Linda family practice residency. I've had lots of experience. I've had a wonderful, wonderful career. I've been an executive physician, chief medical officer, all kinds of board of directors, So, but I have to say, I've never had any burnout. I know a lot of your people who write in will talk about burnout and how we can solve all that. I've never had any of that. So I've just been very, very fortunate. And today I supervise PAs and nurse practitioners out of a clinic. And I also have a small concierge or direct primary care practice. And then I also volunteer teaching UC Irvine and then Cal Poly students that are osteopathic students out of a free clinic one Saturday a month. And I really, really enjoy that. I get to mentor, teach, and just be involved. So, just real, real positive in every way. I've been an independent contractor. I've been an employee. I've been a partner. We had been bought out twice. Surviving entities were, one of them was CVS Pharmacy, and the other surviving entity was United Healthcare. After United Healthcare bought us out in 2014, I decided I didn't want to participate and be part of that culture for whatever reasons. And so ended up doing some locums. Okay, never really opened up another practice, but did some locums and traveled, had the opportunity to work with the Native Americans. I went down to the bottom of the Grand Canyon a couple of times for 2-week stints and just had a wonderful time. And I worked in Northern California. And the reason I bring that up is because in the bottom of the Grand Canyon called the Supai Clinic, they're the Havasupai Indians, and they don't allow for any alcohol to be sold there, but there have so much alcoholism, among the Arizona population that live there, and just struck by that. I didn't see any real, addictions to opioids. But then I went to work in Hoopa, up in Northern California. It's the second largest reservation in California. The medical directors were Native Americans themselves. They bought into all this with pain. And so they actually allow for a sale of alcohol beverage on the reservation. So you don't see the alcoholics there or alcohol addiction, but you do see the drug addicts. So it just breaks your heart to see that and to see everybody who was on methadone. And even the medical directors said, how did this happen? How did we get, badgered into thinking that pain was a sixth sign and a sixth vital sign? So I did this article just on the top of my head almost one evening and looked at a couple of websites and saw and read the November, 2022 guidance from the CDC on opioids. And like I mentioned in the article, we've had so many, we've all been touched by this. And so, it's coming across, just rampantly, whether it's the border or coming through the ports of Long Beach, Los Angeles, New York. But we're seeing a flood of opioids. And we all know that fentanyl is so much more powerful naturally than just your plain morphine. And now I'm reading just a few days ago about they're selling fentanyl-laced OxyContin in Mexico over the counter. That was the Los Angeles Times article just 4 or 5 days ago. So we all can acknowledge, even President Biden talked about this the other day. So then, it's a real problem. And so I just have a heart for it all.
So as a family physician in your practice, just paint us a picture. Tell us about some of the impacts that the opioid crisis has made and you've seen personally in your family practice.
Well, in the old days, we were the pain management doctors. And so, my personal experience was that if I prescribed these medications, they would be on a limited basis. Yeah. And I would have that conversation with patients. I currently, with my current practice, very small practice, I do have a patient that I've given some Vicodin to, okay? But when I say given some, I mean maybe 30 pills a year or so. But the thing I see is, I see other practices that have had, these problems, and they've referred to more of the pain management. So in California, we have so many big, large groups that it's so easy just to refer to pain management. So then they, in my experience, would just continue whatever, their dose was. It's not like they're trying to modify. In my experience, when I've talked to these anesthesiologists that run these practices, yes, they give some epidurals, and yes, they do this for chronic pain, but they just kind of have contracts. And I'd like to see more of a robust approach, comprehensive approach to just like I saw one of your podcasts, one of your ladies, had chronic pain, and she read Norm Cousins' book on laughter, best medicine. I love it. Okay. So I'm not a physician who's ever said that you don't have any pain. I'm just a person that said, can we modify this? Can we incorporate your family? Can we incorporate your support system to where we could modify this?
Yeah.
So that's kind of been my experience.
Tell me about, you mentioned how some entities have classified pain as a vital sign, right? So pain is the fifth vital sign. Tell us what you think about that. And do you think that has played a role in today's opioid crisis?
Yes, I do. I think it's played a tremendous role. And, again, I never really bought into that. I had colleagues say, you've got to write these drugs. You've got to write them. I said, no, I don't think I have to. I'll try this and try this. And if I do give somebody an opioid, it's going to be very, very short term. And
now, who was pressuring you? Who was telling you to write these drugs?
Well, I've had some urgent care physicians. This guy was on the medical board. He wasn't officially on the medical board, but he was an advisor, and he went to the meetings and said, yeah, this is a vital sign. We have to do this. And so, but I never bought into it. I've been around urgent cares, and we've never had, I've developed and built them, and we didn't really, we didn't have opioids. We didn't use opioids except rare circuit. We didn't have any Demerol. We only gave just the injectable anti-inflammatories. Occasionally we'd write some Vicodin or Norco. I didn't dictate what my physicians, wrote, but they knew that when drug seekers came in, they had to be very, very careful. And I'm all on board with in nationally how we keep a record of this now. So any patients who get these controlled substances, we now can track them much, much better than we ever could before. But to answer the question of who told me, it wasn't one individual. It was the Medical Board of California wanted you to have a CME talking about pain. I do recall that. Okay, so you had to take a pain course. Now, they didn't say you had to write, the opioids at all. But like I said in my article, I mean, how is it that we consume such a vast amount based on our population? So those are not my statistics. Okay, those come from the CDC and other articles that I've read. So
yeah, so you wrote in your article that Americans at 4 to 4.4% of the world's population consumes over 50% of narcotics. So that's the data that you cited in your article. So tell us about the new CDC recommendations. So just give us in a nutshell, what exactly has changed?
Yeah, I think it's about, I can't remember how many pages it was. I want to say about 20 pages or so, but it was basically, it said that it was misapplied, meaning in certain circumstances, then because patients have suffered more pain based on the restrictions, of not writing these drugs now, that it's okay in essence to rewrite them now. Okay. So that's what really got me, just up in arms, so to speak. Okay. Why are they coming out and doing this? Well, they felt like people were really being harmed that were denied, some of these narcotics. Now, we all know that any kind of cancer pain, any kind of surgical pain, those are written, and that wasn't what was on the board. It's more chronic pain. And so the CDC article said, we don't think we should be administering these long-acting opioids like OxyContin. We think we need to back up and use them for short term, but still okay, to prescribe them. This issue hasn't really affected me personally in my practice as much as I've seen it, among colleagues, okay, and friends and that kind of thing. So
what have you seen among colleagues and friends?
Well, I mean, they thought it was kind of crazy that they'd come out with this too, because I shared when I play golf, and I've talked to some physicians, and they said, yeah, but it probably isn't going to change, my personal practice, how I practice. But I've just seen that most of the doctors have really ratcheted back and have been not prescribing it.
So one thing that you mentioned was the quality of life, right? And there's a danger that the pendulum has swung so far the other way, is that we're not appropriately treating patients in legitimate chronic pain. Are there any alternative non-opioid approaches that you've seen that would be helpful in these cases?
Well, absolutely. I think like I mentioned, I mean, stress is a big factor. Family situations can make pain worse or make it better. Okay. So you want to tie into some support system for yourself. Maybe it's self-help groups. Maybe it's biofeedback. I know California, we now have, CBD and THC available. And I'm not opposed to that for some people if it works for them and they don't have the side effects. I mean, there's some pitfalls to that, but hey, if it works, it works, and if it's safe. There's all of those kind of things. There's exercise, diet, without getting too controversial about all that. But there's things that people can do. I mean, there's counseling, there's cognitive behavioral therapy that works pretty well for people. So therapy, occupational therapy, all of it is great. I mean, how much do we? What I really believe in is if a person can access stuff themselves and then self-improve that way versus having a whole army of people that are helping them. If they can actually, have that insight to help themselves in a way, that would be ideal. Okay. So I've always tried to promote more independence in my practice. Turns out that patients became more dependent while I'm promoting more independence. Okay. It's just,
How do you do that? How do you promote more independence among patients?
well, I try to say, I'm the messenger. If I believe in vaccinations, then, and I'm going to recommend them, I don't have to have a big discussion of why I think they're valuable and helpful. Here, go to this website. Here, this is a handout. This is what the science is saying. And so look at that. You don't need to have a discussion with me. So you're doing your own, public health review. You're trying to have habits, behaviors that keep you as healthy as you can and not dependent on what necessarily I say or do. Now, absolutely, there's a value to having that human touch. I do believe in that, okay? And I do believe that the family doctor, primary care, is one that is your advocate. He's your friend. He's your support system too, to encourage, good behavior for what works for that person within the culture and the context. I have the highest respect for all patients and wherever they're coming from. I try to meet them where they are. You try to have that empathy and understanding of who they are, because we're all the same, but we're all different.
Yeah.
So
we're talking to Ronald Zent. He's a family physician. His Kevin MD article is titled "How Were We Duped and What Can We Do About the Opioid Overdose Crisis?" Ronald, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Well, I think, people who are in the healthcare industry and people who have, contact with patients, I think, we have to meet them where they are, and we have to, we can't be so absolute in our approach and so dogmatic. And so, you want to know where the patient's coming from, and yet your own personal life has to be such that that you do have that empathy. You strive for that understanding of where they're coming from. And so that's what I would say, and then be involved in any way you can with improving the system. Improving the care that you're giving your patients. You're going to Disneyland, you're turning off all the problems at home, and you're wearing a smile, and you're going to do the best you can that day, for the patients. And, just if you're not happy with where you are in your professional life, then make a change. Okay. Or adjust. And like I say, I've had a wonderful career. I'm still working and I enjoy it. I love it. Okay. I don't have to have any of those negative things. Just my kids work for me. Okay. So they said, Dad, you always try to have fun. Have fun in your practice. Make sure it's enjoyable. Okay. That would be a take home. Okay.
Ronald, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Kevin. Bye-bye.